So first, I would like to thank ZEISS for inviting me to talk here in Rome today. My name is Porto and I work in Instituto Oftalmológico, and I'm going to explain you how I use the OCT tools in my daily practice. So there is no doubt glaucoma is a fundamental tool, OCT is a fundamental tool in glaucoma. We will do to most of our patients an OCT and a visual field. But it's also true that depending on the stage of the glaucoma, the importance that we give to each test may vary. So an OCT is becoming more and more important in earlier stages when the visual field is still preserved. We know some studies have demonstrated that we can detect the RNFL thinning in the OCT even 4 years before we can see that visual field loss. And I feel that now this is very important because our approach to treatment is changing. We are not waiting that long to see that visual field progression. We are trying to be more proactive, and with the introduction of MIGS and therapies like the SLT, we are trying to act earlier. So understanding all the potential of our device, we will decrease the number of patients that develop severe visual field loss in our clinic. So here we have the series reports. We have the structural markers there, that are the optic nerve head, the retinal nerve fiber layer, and also the report of the ganglion cells layer complex. If we see superiorly, we see the thickness maps, then we have the deviation maps, we have some tomograms of the areas that are measured, we have the color sectors in both reports, we have the key parameters table, and we have the profiles of the neuroretinal reading and the RNFL thickness. But we know that if we only check these average values and the color sectors, we can be missing some localized defects. So to don't do that, the last guidelines, they recommend us to check the deviation maps. Some OCTs in the market will have tools like this one. This is the PanoMap from ZEISS, and it combines the two deviation maps in one. So we will see the three areas that are being measured in a wide field view. And this helps us because we will recognize the glaucoma pattern that we are looking for. So if we remember these patterns, we know that depending on where the cupping is localized, we will have some defects in one place or the others. So if the cupping is more superiorly, we will have a defect in the RNFL superiorly, but not affecting the macula. And if the cupping goes inferiorly, it will affect the RNFL inferiorly, and it could also affect the macula. So if we see the examples here of the PanoMap, we see that cupping going inferiorly and temporally. So we see the defect inferiorly and also in the macula. If we see here the cupping superiorly, we will see the defect in the RNFL superiorly, but the macula is actually preserved. But what happens when the reports of the OCT, they give us these yellow and red sectors, but we can't find any pattern? And this is when we need to differentiate between real glaucoma and what some authors call the red disease. And red disease is a false positive. It's when the OCT looks like glaucoma in a healthy eye. So this is quite common, and in order to differentiate this, you need to learn the limits of the device. So first, very obvious, this is the quality, okay? Black areas, they are not measured. Eye movements, wrong segmentation. Always retest again. Media opacities, like cornea opacities, also cataract. Vitreoretinal traction also interferes with that. The anatomical variations, if we have axial length, peripapillary atrophy, tilted disc, it can give us a reports like this one with these weird profile measures. So always remember to check the discs, because most of the databases, they include between 200 and 400 healthy eyes. So the cubes that the OCT use to measure these areas, they don't fit properly. And that's why you have this kind of reports. Of course, if you can always compare it to function, if you work with Forum, you can have this kind of report, integrate all the information, and you can have a better idea of what is happening with your patient. If you're still doubting, I would like to mention this. This is a diagnostic calculator that was developed by a group in Spain. It's a very simple Excel. It's exclusively for ZEISS database, and you introduce the values there of the OCT, and you will have the probability of your patient on having glaucoma. Now, talking about progression, we know that progression is the key to choose the right management for our patients. We know that structure changes can predict the visual field damage, and that can make us detect progression in a preperimetric stage. Very important, this progression does not depend on a database. So the actual measurements, they are compared to the patient's own baseline. Does not depend on the patient's subjective responses, but it's also sometimes hard to interpret this information. So you have here the reports. This is the guide progression analysis, the software that ZEISS uses. We have superiorly with those maps the event analysis, and then we have the trend analysis. So the event analysis compares the actual measurements to the baseline for a specific point. So you will see there in the deviation maps how the red areas, they increase over time. Then underneath you have the graphs with the trend analysis. So the trend analysis is a regression analysis. It's parameter versus time, and so it will give you the rate of progression per year. It's what happened before and what is going to happen. So very important here. And at the bottom you see the profiles there, that is baseline 1, baseline 2, at the actual profile. This is quite useful. Actually, I show that to the patients a lot. In the second page, you have the values of the analysis with some colors depending on probability. For the macula, you have the same. So first, of course, very obvious, don't check only the colors, check always the numbers, because the limits of the OCT are numeric and they're very precise. Sometimes you can find the same number with different colors, depending if it's 68.2 or 68.7. So always check the numbers. The progression follows a pattern always. So when you see those values changing in the report, check the deviation maps and that those red areas, they increase over time following a pattern. If you see that the red areas, they are not increasing, it could also be that the defects, they are getting deeper. Here, you should check always progression in both sides, the RNFL and also the macula. Here we see this defect in a patient superiorly in the left eye. And then if we repeat the test later, we see superiorly and inferiorly the defect in the left eye. We see some defects in the deviation map of the macula, but actually the values, they are quite preserved. So always check progression in both sides. Age-related loss. We know healthy patients, they lose fibers per year. So some studies had tried to estimate how much we lose and how much that interferes with the trend. So younger people, they lose more fibers per year, and thicker, fuller discs, they lose more fibers per year. And this is very important to interpret correctly our trend. So the trend is information that you need to know how to manage and you need to work with it. The trend is flexible. If we see this patient here, it detects progression, the analysis, but if we look a little bit closer, we see that the baseline testing, they are separated 10 years apart from the actual test. So if you move this baseline a little bit closer, you can see that there is actually no progression in this patient. So this is crucial. We are not looking for every progression, we are looking for a fast progressor, because we know that who we need to treat is the fast progressor in a context of life expectancy. Sometimes we follow these patients over 10, 20 years, lots of information to manage. This is how my screen looks like. I'm sure some of you know how Forum works. Here we have the trends of the OCT, also from the visual field. We have the graphs with the profiles, and we also have all the testing there, so you can access them just by clicking on them. Some take-home messages here. OCT can help us to diagnose glaucoma and decrease the number of patients developing visual defects in our clinic. PanoMap is a useful tool in diagnosis to detect glaucoma patterns. We need to be aware of the limitations of the OCT in order to interpret information correctly. The age can interfere in the rate of progression, and structural change doesn't imply a treatment change. Rate of progression and life expectancy are crucial. Thank you.